Hello, wanted to do a short podcast on tooth pain, periodontal pain, hygiene, dental hygiene, cavities, root canals, etc. with transdermal magnesium. There's nothing better than this product, not because we sell it or whatever. You can go buy someone else's version; it doesn't matter. But I mean, if as long as you find the glass bottle and the Zechstein logo on there, then go for it. But the most important thing is to understand magnesium and what it could do for the teeth. So putting like 5 or 10 sprays of this into the mouth and letting it sit for about 20 minutes. It doesn't taste very good, but you let it sit for about 20 minutes. You don't do anything. You just sit, and so it'll go underneath the jawline, and it starts to kill bacteria underneath there. It has a molecular weight, which is three times heavier, no, 30% heavier than water. It helps push the product down deep into the jawline, and it pushes out bacteria that are underlying the jawline, and it also through the tissues. It absorbs through the tissues. The tissues have a natural affinity to magnesium, and being composed of magnesium as well, the tissues. So there's this need that you will have. I mean, you'll know that you'll need it whenever the teeth start hurting, like from sugar, from white sugar, any type of sugar basically. Cane sugar is going to be better because it's not genetic or whatever, but still it can still get you in, especially if it's separated from creams and butters and fats and things like that. Then it gets really bad. So getting this underneath the jawline is a key. And so what you'll notice is after about 20 minutes of letting it sit there, those pains, those tooth pains and like cavity pains, root canal, sometimes they're affected. The bacteria under the jawline, this is well known in certain parts of dentistry, and alternative dentistry, IABD, biological dentistry, etc. You'll start finding, a lot more people who know about these inflammations that are happening under the jawline due to root canals that were done somewhat less than optimally. Maybe even the best root canal in the world is still having some of this too. Even sometimes pulled teeth are having cavities and pockets and nerve tissue and things which are creating bacterial low oxygen areas, and so there's all these things that can be created by not doing a thorough job in there, which is not what dentists are taught in dental school. They're taught to avoid certain nerves and just get the job done and do it easy and fast. And so going to that extra level and having the skills to temper the sword and all those things are typically what is left out of a lot of medicine. And so it's more like it becomes mechanics, and everybody goes to this baseline strategy. So what happens is we get these pockets, we get these problems, etc. Like there's even a lot of dentistry now that's going against the idea of root canals in general. So anyway, underneath that jawline, there's going to be these bacteria sometimes. Sometimes you can feel it too by touching. If you push hard underneath the jawline, you can feel these kind of like painful areas, or feel something that's offsets a little bit. I mean, it can be deep, so sometimes it's not always at the surface, but sometimes you can feel around. And so anyway, so these type of pains are going to disappear for sometimes months at a time, even if you're doing one treatment, depending on your if you're drinking 3 Cokes a day, then no, that's not going to happen. But if your diet's right and there's not a lot of acidity coming through, and the acidity in the mouth and everything else, you've got that under control through kind of a more sober type of diet. Not the alcohol, stimulants, coffee, sugars, and all this kind of combinations, but you have a more sober. Like sober, when I say sober, it's like when you look at how homeopathy patients, people that would test remedies for homeopathy, they had to give them a very sober diet, and there was no pepper and spices, and there was all this stuff, So that's really sober. But so yeah, trying to keep it as sober as possible, so that you can see what's happening, and so yeah, this is going to help clear that out very quickly. It can be used for dental hygiene if you use just a little bit. Like you can dilute it with like 60-70% water, 80% water, and use that separately. Or you can do like a little bit on the toothbrush kind of thing, just like a drop. And there's a way to kind of clean on the bacterial level. But the best part of it is really getting underneath the jawline and clearing all that out. Now, I don't recommend doing that all the time. That's something you could do maximum once a week. depending on how serious all your issues are. Because the magnesium needs to be understood. It's just like tempering the sword once again, where what it can do for the teeth is amazing, but you want to do it pure. Okay, so that same purity can be abrasive for the gums. So the teeth are okay with that, but the gums are not. So you don't want to overcharge the gums with this kind of intensity, this fire or whatever it is. So you want to do that in a certain rhythm, right? And so, I mean, it's not bad for the gums, once again, if you dilute it. So if you put it at 80% spring water, well, then there you go. Now you can use it for the gums daily. It's not a problem. And it's used in dentistry at that dilution as well, for antibacterial, et cetera. So, or even for cauterizing, I think, healing, stuff like that. So, so it's all about how much you dilute it, et cetera, and for what part, right? So, but it's powerful for the teeth. There's nothing like it, and you can keep the dentist away for years and years and years with this stuff. Not saying that's always smart or whatever, but like there's something to be said about the independence that it can give you. So come check us out at theheartoftradition.com. Don't get the fake stuff. Always get it in glass. Always look for the Zechstein Inside logo on the bottle. Otherwise, it's impossible to know if it really comes from the Zechstein, because there's only one source that issues the logo, and there's only one source in Holland from which everyone's claiming to have the Zechstein product. So if they don't have the logo, then it's impossible to know what they're using. There's usually self-certified schemes and genuine and ancient and authentic and all these other kind of self-certified logos and stuff. So get Zechstein Inside, the real deal, the one that the doctors prefer all over Europe and the sports medicine, and it's pure. There's nothing else in the product. It's not diluted. It's not been solvent extracted. It's not been chemically treated. So you have to chemically treat when it's not a natural state discovery of bischofite stone, which is a natural magnesium chloride. So whenever you don't have that discovery, you have to use chalk and solution mining to pull out these layers that are not pure, that are contaminated with potassium, heavy metals, and stuff like that. And then you have to pull solvent extract, get that out, and clean it. And then you sell it as magnesium oil, and nobody knows the difference. And you can use the word Zechstein because that can't be controlled. So, so there's a lot of like fakery here. So just get the right stuff. Come check us out at theheartoftradition.com. Thanks.